Good afternoon, MercyOne. In ongoing conversations with clinicians and colleagues, we've heard questions about MercyOne's financial position due to the impact of COVID-19. During this global health crisis, many people outside of healthcare are surprised to learn healthcare providers have been devastated by the pandemic. They assumed our hospitals and clinics are full of COVID-19 patients. After all, we're on the front line of the battle against COVID-19 and working to care for patients who need us. However, like other healthcare organizations, MercyOne has been impacted significantly by COVID-19, but mainly for two reasons. Non-emergency surgeries and procedures were canceled or postponed, and we lost the revenue for these services, which provided a large portion of our business. New COVID-19 supplies, equipment, and resources were needed to fight COVID-19 at the same time to save lives in our community. To help offset these costs, our teams took immediate action to reduce expenses, including a freeze on capital spending such as major projects. We reduced executive leadership pay, furloughed positions, and provided low census status, and we worked with vendors to reduce their costs. Additionally, MercyOne has received funding from the federal government's CARES Act. While this funding helps offset a portion of our lost revenue and the expenses we've incurred, it's not nearly enough to cover the total loss, which extends beyond the direct costs related to shifting our focus entirely to care of COVID-19 patients. Reduced volumes for non-urgent procedures and elective services during this time alone are estimated at $175 million, compared to the CARES Act funding we received of $88 million. Prior to COVID, MercyOne's financial position was very strong. We are launching forward-looking initiatives to ensure we're able to rapidly regain our financial health and prioritize safe care for our patients and colleagues to advance our mission. Thank you very much for your ongoing work to be a compassionate, healing presence in our communities. We are here for you, and we're ready for our path forward as one. MercyOne has been and will continue to be in a very strong financial position. However, it's going to take hard work and many changes to cover the losses of COVID-19. Our main concern is the health of you, our colleagues, and our communities as we continue this battle together.